What's going on, everyone? Welcome to the Wednesday edition of the Pandemic Update for Wednesday, May 24th, 2023. Hopefully, everyone's staying safe and healthy. If you had to take a COVID test, hopefully you have tested negative over the last 24 hours. Starting off today with India. India has reported another 552 cases, and their death toll has further rose, and they have added 6 new deaths today. Checking this out. A COVID-19 outbreak has been declared at Northumberland Hills Hospital in Coburg. I think I'm pronouncing that correctly. Apologies if I'm not. But this is in Canada. It's outside of, just northeast of the Toronto, Canada area. So, yep, another COVID outbreak. And we just reported on a COVID outbreak in Western Canada the other day. So it would seem that COVID cases are rising there. And it makes sense because there's clear evidence that we are starting to see a rise in infections here in the United States. More on that when we get to the state data shortly, especially in New Jersey, where it's relatively concerning. All right, this one is about people paying for operations up by 1/3 since the COVID pandemic, and this is over in the UK. And this is really sad. It's bad. It says the number of people paying privately for operations and treatments in the UK has risen by more than 1/3 since the pandemic started. Figures show last year 272,000 people used their own money to pay for treatments such as knee or eye surgery, up from 199,000 in 2019. So that is not good, and we know healthcare is expensive to begin with. It's bad to see that more people are having to pay for healthcare, especially nowadays when healthcare is just so overwhelmed and many people are having to delay treatments because of ongoing issues with healthcare. All right, now we come to this. Remember a few months ago, a matter of fact, 3 months ago, Jimmy Carter, former President Jimmy Carter, had entered hospice. Well, guess what? It says he is in good spirits. It says here, 3 months after entering end-of-life care at home, former President Jimmy Carter remains in good spirits as he visits with family, follows public discussion of his legacy, and receives updates on the Carter Center's humanitarian work around the world, his grandson says. He's even enjoying regular servings of ice cream. They're just meeting with family right now, but they're doing it in the best possible way. The two of them together at home. Jason Carter said of Jimmy and Rosalind Carter, now 98 and 95 years old. God bless them that they have lived that long, and I hope he continues on. I hope he continues to pull through a little bit longer. All right, this is really, really bad news. Brazil, pediatric intensive care units, PICUs, are full. They're saying it's full. There's no more capacity due to the outbreak of flu and severe acute respiratory syndrome, otherwise known as SARS, in Ampa. The Brazilian Navy sent 12,000 tons of oxygen to the public hospital network. So this is really concerning, and it's continuing with the theme that we are seeing, that COVID variants over there and also in Thailand are potentially more severe in children at this time. I don't want to speculate too much, but we have read a few stories in the last few days that are confirming some more severe cases in kids, and well, this confirms it as well, because if the ICUs are full, you just have a bad combination of things going on over there right now. Alrighty, taking a look at some Hubbub World data, and let's refresh this. We just want to take a look at some of the COVID forecast across the country, and you can see here, COVID-19 is expected to continue to be high in New Jersey, New York City, Long Island. So a lot of these people in this area are going to be traveling for Memorial Day. That's concerning. You might want to test beforehand with those at-home tests. Make sure you're not carrying COVID with yourself down to say the New Jersey shore, the Connecticut beaches, Cape Cod. Maybe you're going up to Maine or upstate New York or the Pocono Mountains in Pennsylvania. It's going to be a risky spread of transmission this weekend, and I suspect we're going to see an increase in wastewater next week. And in fact, New Jersey, we're already seeing the increase in hospitalizations. We'll get to that in just a moment. Look at wastewater for today, as we have nothing to report on for this day in COVID history. Today in wastewater, as you can see here, we continue to have not much has changed here. Hopefully by the end of the week, maybe we'll get some updates on some of these wastewater sites, but I'm not seeing any updates as of today. But let's just run through these numbers. Anyhow, new sites 144, 0 to 19% of COVID found in wastewater, 539 sites, 20 to 39%, 424 sites, 40 to 59%, 128 sites, and the concerning levels, moderate to near high, 22 sites, and high, which is 80 to 100%. That is down here in South Carolina, and we can take a look at that site. It's in Beaufort County, South Carolina, and you can see here, it's not a terribly big wastewater site, just 20,000 people, but look at this, it's going straight up. Hopefully we can turn that trend in this week's update if we get one. If not, this is really concerning, and this is an area, if you're planning on traveling for Memorial Day weekend down to that area, I would think twice. Your risk of COVID in that area is relatively high right now, just based on the wastewater data. Alrighty, moving on to the latest variants. XBB.1.5 is at 64%, XBB.1.16 is at 14.3%, XBB.1.91 is at 9.2%, XBB.1.92 is at 4%, XBB.2.3 is at 3.5%, XBB.1.51 is at 2.4%, and FD.2 is at 1.8%. Hopefully, it is a holiday weekend coming up. Hopefully, we will get our bi-weekly update of the variants. It's supposed to be every other week, and we are due for that this upcoming Friday. Alright, now to New Jersey, which I have mentioned several times. Concerning trend going on here in the hospitalizations in New Jersey. If you notice, they are up to 214 hospitalizations today. Back on the 19th, that was only 156. Look at the chart here. I'll zoom it in a little more. You can see here, it is starting to rapidly go up. Yesterday was 184. Today's 214. This is a rapid rise. I'm not liking this trend. Now, if we go back to the beginning of May, we also did have a rise where it did go up. So hopefully it starts going down later in the week. We'll have to just wait and see. Alright, taking a look at Philadelphia for today. We like to check the EMS call volume here. And this is one of the only cities that I see posting daily. I've tried to look for other cities. I've checked New York, I've checked LA, I've checked Chicago. Not seeing it, but Philadelphia does it. God bless my city for doing it. And 760 EMS incidents in the last 24 hours. That is higher than we would like to see. Ideally, I like to see that number below 700. So they had a busy day for ambulance calls yesterday. And let's just quickly do a check-in of what's going on in the suburbs of Philadelphia right now. At this very moment in Montgomery County, there are 16 EMS calls for, there's some bad ones here. Cardiac emergency, fever, cardiac emergency, stroke, cardiac emergency, respiratory emergency, altered mental status, hemorrhaging, that's not good. So there's a whole array of things, seizures, head injuries. Yikes, it looks like a busy day there. And let's check on Chester County, Pennsylvania. Respiratory difficulty, but not a lot of calls there right now. Alright, moving on to New York State. We're continuing to see a positivity increase there, and we're starting to see a case rise as well. Remember, these are only first-time infections, not reinfections or at-home tests. 490 new cases in the last 24 hours, 3% positivity, and the 7-day average is 3%. Taking a look at hospitalizations in New York City, and we will do New York State as well. Let's refresh this. And taking a look at New York State first. Let's just do that. New York State, they are up again today. Yesterday was 585 with 66 people in the ICU. On today's update, that's 594 with 59 people in the ICU. So the ICUs did drop, but the hospitalizations did increase ever so slightly. We're not seeing a rapid increase yet. but nonetheless, it is an increase. Taking a look at New York City, in New York City, today's hospitalizations are 225 and 23 people in the ICU. So again, not an increase in ICUs, but there is somewhat of an increase in hospitalizations. Looking to see if Texas updated yet. They did not as of the time I started recording this, and no, we still don't have an update out of Texas. I'll get that to you in tomorrow's video. If they do decide to update, they are supposed to update on Wednesdays. Let's briefly take a look at some international data, and you will see here, South Korea cases are down just shy of 1%. Deaths are up 5%. Brazil, cases are down 38%, and deaths are down 20%. But remember, in Brazil, we are seeing that problem going on with the pediatric situation. So we have to pay close attention to that and not pay close attention to this percent. Take a look at Russia. Cases are suddenly up 5% again. Deaths are up 16%. Taking a look at New Zealand, cases just up 0.5%, and deaths up 1%. Philippines, cases down 2%, deaths up 1%. Mexico, cases are now down 4%, and deaths are up 29%. Malaysia, cases are down 25%, deaths are up 33%. And coming down here to Germany, cases are up 36%, and deaths are down 35%. And we'll end today on Thailand, where cases are up 12%, and deaths are down 191%. Alrighty, that does it for today's pandemic update. Did not have a lot of news for you today. I'll be honest, I did not have a lot of time to research for news stories. Maybe I will this evening. I don't know. It's been a busy day for me today. Hopefully tomorrow I will have more news for you, and a bit longer update, closer to the 15-minute mark. But nonetheless, we did get an update in today, and we saw some concerning trends coming out of New Jersey and New York, which are close to each other. And if you live in those areas, please stay safe this weekend, especially in New Jersey, as we know there's going to be a huge rush of tourism at the New Jersey shore this weekend, where millions of people will flock. Alrighty, if you like this video, give it a thumbs up. If you want more content like this, subscribe to my channel down below. I'll see you all again next time. But until I see you again next time, stay safe, everyone, and thanks for watching.